Okay, so what we're going to talk about next is the possible benefits of taking part. So I can't guarantee or promise that you will receive any benefits from this clinical trial. However, you will be helping the research community test if sodium benzoate is an effective add-on treatment for early psychosis. Okay, because as I said to you before, we don't know what arm of the study you'll be taking, but certainly your contribution, so you're participating in this study, is going to help in terms of future treatments for early psychosis, or future studies in relation to early psychosis. Okay, so that's really important. So the benefit of sodium benzoate, as I said, cannot be promised, nor can the chance of benefit be accurately predicted. So we can't say, as I said, what arm of the study you'll be taking at this point in time, and what benefits even into, the future will have until, we conduct this study and see what the benefits are, or what maybe not benefits are, in this study.
Okay. I guess just thinking about it with this sodium benzoate thing, a little while ago you mentioned that they've got it in some of the foods and stuff like that. So if it's in all the foods, why is it something that simple gonna possibly help?
Well, what they've seen is, or what they've researched is that, they've found that this particular, compound that's in sodium benzoate, or part of sodium benzoate, does in actual fact help people who suffer from psychosis. So they have found that some people's symptoms have improved, and certainly some people have, their cognition, so their ability to be able to function and, process information has improved. So we're replicating that and trying to see whether it does in actual fact. We see those benefits in the people that we recruit to this study.
Okay, so but what if I'm eating a lot of those foods or drinking a lot of those drinks that have that stuff in? Wouldn't that mess with the results? If I'm on like the sugar tablet and I'm taking all these things and it maybe helps me, wouldn't that mess up the study a little bit?
It's not going to mess up the study. All we're asking, and I'll get to that down, further down, in terms of some of the medications or some of the other things that we don't necessarily want you to take, because it might have side effects. But I suppose the amounts that are in other foods like juices and what have you is not the same amount of what we're actually asking you to take. So they're lesser amounts.
Right.
Okay, so whereas this is a bigger amount, and this amount is actually what has benefited people with psychosis.
Okay.
Okay. So some of the possible risks and disadvantages of taking part. So if we talk about the cognitive tests that we're going to be doing, so on a fortnightly basis, when we're coming and asking you to do paper and pencil tasks, you might feel a little bit distressed, about some of the questions that we might ask, or you may not. But very occasionally, talking about mental illness can bring about, some emotions that you may not feel comfortable with. If that does occur at any stage, the researcher will, stop the questioning, and, you might need to take a break, or you might need to, come back the next day or whatever. But we would discuss that at that particular time, should it occur, and, address it accordingly.
Yeah, okay.
All right.
Yeah, I just, I don't really
Think
often
that
like talking about it all the time. It's just, I always talk about it, with everybody.
Yeah,
and it's just,
sure. So you feel comfortable doing that, and it doesn't distress you as
no,
much?
No, it's more just I don't enjoy it because I do it so much.
Yeah, sure,
so,
sure.
Yeah.
And we'll take that on board. And as I said, if you feel that, you can't, continue with the questioning, then absolutely we would stop that then and there, and that's no problem.
Yeah,
we can come back to it.
Sometimes I guess I just feel like a lab rat almost.
Yeah, sure,
it's
sure. Absolutely.
It's a bit hard.
And I do take that on board, and as I keep coming back to saying, and I'll say this all the way through, that it is voluntary, and if you feel that you can't take part in it, then that's your right.
Yeah, well,
and even halfway through, if you feel that, you can withdraw at any time. No problems at all.
I think I want to help, it's just
Yeah.
It seems like there's just a lot involved sometimes, you know.
There is, absolutely, and I take that on board. Okay, so, and also the clinical assessments, because it takes an hour, you know, or, you know, possibly even a little bit longer, depending on the day, depending on how you're feeling, you know, that's an inconvenience to you, and we take that into consideration as well. So again, if you need to have more breaks than what you might have done the week before or the fortnight before, then we conduct that in that fashion. Okay, so the blood test, you know, if you were to do that, and I know that you've pointed out that you're not keen, but sometimes you might get a little bruise. But obviously the people that that we're contracting to do that, to take that blood sample, are skilled, you know, clinicians, and you know, rarely does those side effects occur, or the bruising and what have you. So we're just talking about medical side effects. So you may get some or none, and they might be mild or severe. So and some of those might include you know, vomiting, you know, diarrhea, a rash, some weight loss, and even, you know, lack of appetite. If any of those symptoms occur, you need to let us know immediately, okay? And, you know, you might have to go to the doctor, and in those events, you know, we would be asking a lot of questions in relation to that, because we, you know, we need to know whether it was associated with the sodium benzoate, or it could be completely unrelated to the sodium benzoate. But at any rate, you need to be upfront with us and let us know of any side effects that you might be having at that particular time.
Okay, and then if I felt like after that I didn't want to continue that, I can just say
Absolutely,
that?
absolutely. Okay. And as I said, it won't affect you now or into the future in terms of your treatment.
Okay.
Okay. All right. And usually, you know, those sorts of things, you know, they'll go away shortly thereafter. But in the event that they don't, then we would be monitoring that, you know, on a weekly basis. Okay, asking you questions on how you're feeling, and, you know, has anything changed, you know, those sorts of things, and engaging with you know, your clinical team as well. How are you going with all of that?
I'm getting there.
Yeah, getting there?
Yeah.
Okay, you happy to continue?
Yeah.
All right, okay. So some of the other things are that, that we don't want you to take big doses of vitamin C. All right, so vitamin C interacts with sodium benzoate, so we'd prefer you to stay away from, you know, taking large doses of vitamin C. All right, so
orange juice and stuff.
Yeah, but big dosages. So, you know, we'll talk about that a little bit later in terms of, you know, just having a glass of orange juice is okay, but if you were drinking, you know, litres of orange juice, then we would be certainly asking you to avoid that.
What about things like energy drinks? Because I tend sometimes to, you know, drink some energy
drinks are okay, yeah, in terms of, because I don't think they've got, you know, vitamin C, so ascorbic acid is the other word for vitamin C,
okay.
So you just need to be conscious about.
I guess I can have a look on the can.
Yeah, so okay. Not having those big dosages is really important. Okay, all right. So the other important thing too is that the effects of dose of sodium benzoate are used in this particular study on the unborn child. And I know that you're not female, you're not going to have, you know, children, but certainly you could father a child. And so those effects are unknown. So basically what we're saying, if you're male, you should not father a child or donate sperm, you know, 1 month after the last dose of the sodium benzoate. So at, you know, week 12, a month after that, you know, we wouldn't want you to, you know, father a child during that stage. If you were to, then obviously we just need to know so that we can monitor that process. Okay, so if there might be any side effects or those sorts of things, so we have a duty of care to let you know that in the first instance. So we're encouraging both females and males to use an effective form of contraception, okay, so to try and avoid, you know, a pregnancy.
Okay.
All right.